The smoldering myeloma is a part of the monoclonal gammopathy spectrum that is of great interest, and particularly so because there are some recent trials that are starting to show some benefit in treating these patients early. The conventional wisdom has been that patients with smoldering myeloma should not be started on treatment until they develop some end organ damage. Now, a few years ago, based on some of the studies demonstrating that about 10% of these patients can have relatively rapid rate of progression, so almost an 80% risk of progression in 2 years after diagnosis, the diagnostic criteria was changed to include some what we call biomarkers of risk of progression. And that included a bone marrow plasma cell percentage of 60% or more, an involved to uninvolved free light chain ratio that is more than 100, and also 2 or more lesions on advanced imaging studies, particularly MRI of the spine or PET-CT. Now, these patients, given the extremely high risk of progression, were considered as myeloma and were treated like myeloma. But the remaining patients still have a relatively high risk of progression to active myeloma, and almost half of these patients might actually progress to active disease in the first 5 to 10 years from diagnosis. So the focus has been trying to see whether early intervention with the intent of either preventing the progression to myeloma or giving more intense therapy to try and cure the disease has become more of interest. So the Spanish did a phase 3 trial that demonstrated that treating patients with smoldering myeloma with lenalidomide and dexamethasone improved this progression-free survival and also improved the overall survival. Now, there's more recent data from the ECOG trial showing that intermediate and high-risk smoldering myeloma has actually improved progression-free survival by treating them with lenalidomide instead of just observing them. So there is clearly interest in starting some form of early intervention in patients with smoldering myeloma. But one of the key features or requirements of initiating early therapy is the ability to identify patients who are at high risk of progression. Now, since the diagnostic criteria changed, we wanted to develop a new risk prognostication system for identifying patients at the higher risk of progression to active disease. So we looked at the data from the Mayo Clinic and came up with a new scoring system that uses a cutoff of 20% plasma cells, 2 gram per deciliter of M spike, and 20 involved to uninvolved serum free light chain ratio. And if patients had 2 or more of these risk factors, their risk of progression was almost 80% at 5 years. So we are continuing to work on trying to redefine or refine the risk scoring system by incorporating some of the additional features like FISH testing and so forth as part of a larger international myeloma working group project. But overall, I think the smoldering myeloma is going to be an area of great interest because of the benefits seen with early intervention. And this then logically leads to the next question or step as to whether we should be screening people to try and identify the patients who may have smoldering myeloma.